Then Dr. Muhammad Afroz Alam is going to present on impact of surgical volume on intraoperative complications in manual small incision cataract surgery.
Good afternoon, everyone. So my topic for today is the impact of surgical volume on intraoperative complication in MSICS. So first, why there is need of volume surgery and why we did this study. So globally, there is estimated 596 million people is suffering from distance visual problem with 43 million people blind. That means having vision less than 3/60. Of this 43 million, almost 50% is due to cataract. And if we see the Indian scenario, India shares almost quarter of the blind population of the worldwide. And recently, high volume cataract surgery has evolved as an approach to clear the cataract backlog. And especially in Bihar, which lacks in effective cataract surgical rate coverage, national average for the cataract surgery per million people is almost 6,000 to 7,000, while in Bihar there is a 2,600 per million population. Cataract surgical rate is 2,600 only. So, and most of the cataract surgeries are conducted in winter season only. There is misbelief that one should not get operated in summer season and harvesting season. So many hospitals has to tackle a lot of volume during winter seasons. That's why volume surgery becomes necessary to tackle the cataract backlog. In Akhand Jyoti, we annually perform more than 90,000 surgeries. So, and 2/3 of these surgeries were usually performed in winter season only from October to February. There are many studies that have shown the annual volume and surgical complication rate, but there is paucity of articles on daily volume. There are few studies one study from Arvind in 2005 and from Nepal in 2022, which have shown favorable result in high volume cases, but there is lack of studies from northern part of India, especially from Bihar. So we did, with this in mind, we did this study. We have compared the high volume versus low volume complication rates and also the surgeon's experience. We have not included any surgeon who is less than 2 years of volume surgery experience, and we have categorized surgeons into 2 categories, 2 to 5 and more than 5 years of volume surgery experience. We did this retrospective study we have taken data from the hospital EMR. Eligibility criteria were only those surgeries which were purely MSICS, not those who were converted to MSICS and was phaco, planned as phaco was included, and any difficult cases like pseudoexfoliation, hypermature cataract with lax zonule, lens-induced glaucoma, these were not included. So total 11,763 surgeries were included, and in high volume case, high volume we did almost 7,832, and low volume 3,831 surgeries. 59.3% were male and 40% were female, and overall complication rate was 2.06%, which is almost similar to the other studies, but in higher volume cases, complication was rare, 1.72%, then 2.14% in lower volume, with odds ratio of 2.05%. And most common complication was PCR with vitreous loss. Second most common was zonular dilysis. If you see the surgeon's experience, even with the lower experience, higher volume days were having lesser complication, fewer complications than lower volume days, with odds ratio of 2.86%. If we see the surgeon's experience also. And so high volume surgeries have completely lesser complication rates. So experience of surgeon can reduce complication rates in both high volume and low volume. And as we have seen from the WHO World Vision Report, to increase the cataract surgical coverage by 30% by 2030, so institution by adopting the high volume surgery can help eliminating needless blindness from the cataract. So, thank you.
That's okay. Your study shows it is a less complication
Yes,
compared to other one. So why?
Uh, we had two limitations. One was in low volume days the patient age was more, so that can be the one of the reasons. Second reason is in high volume days workflow is more efficient. Surgeon is more focused and maybe the less complicated cases or less complicated cases are posted for that surgeon who is doing high volume, just to make him do faster or something.
Yeah,
Yes.
because you have categorized experienced and less experienced.
Yes, sir.
But you have not taken the age as a criteria.
Yes.
Okay. So, anything?
Yeah, in 2005, you were mentioning about Arvind paper. I was in Arvind in
Yes,
2005. So good that you have presented from North India also. See, the thing is, I want one clarification. What 50 per day and more than 50, that is single surgeon or multiple surgeons?
No, sir. For single surgeon, 50 per day
Single
is
surgeon,
considered.
50 per
We
day
have
or-
considered.
No,
Arvind has
actually
considered-
NPCB, I think it is not more than 20.
So I think 25 per room may be allowed.
May be allowed.
If you are doing in 2 rooms, maybe. But anyway, this is good that you are because you have divided them into. This is how we also do. Higher volume days, we select regular cases, normal cases, and higher volume, higher experienced surgeons who can do faster without complications, and post, as you said, the pseudo exfoliation, small pupils, and all those on a different day with the lesser number, so that they can spend more time and reduce the complication rate during that also. So that is the way it has to be done, and you people are under stress to do in the winter season. That is also true.
Yes.
I realized that when I went the first time to Rajasthan in 2004 or something, and then I realized that that is the time we do. Otherwise, we cannot do it. But it is not there in South. It's not like that. Every day we can do. So, otherwise, good. Please carry on the good work you are doing.
Thank you, sir.
I have one question.
Yes, sir.
You said that if you are operating more number of the cases, you are more concentrating. If you are operating, say, since morning 8 o'clock, and you are operating 50 cases, as you said, don't you feel in the last phase you get lethargic or something like that? And
Sir,
you
usual duration of surgery is 2 to 3 minutes. So
2
if
to
we
3
get
minutes
gap
in
in between, we
SICS.
get irritated. Yes, sir.
2 to 3 minutes. I have yet to see. I have seen Blue Menthol also operating. 2 to 3 minutes cataract surgery with IOL is a dream. I don't think practically somebody can do in 2 to 3 minutes. I have never seen.
Sir, my one video is getting published next month. That is less than 2 minutes surgery.
2 minutes.
Yes, sir. 1 minute and 30 seconds, 1
minutes,
minute
no.
15
It
seconds.
will be around
And results are better because we
24 is an average number.
do minimal manipulation inside the entry chamber. So results are even better. Next day cornea is quite clear.
Fantastic.
Yes. Sir. Thank you, sir.
Okay, good.